Welcome to Seasons Up Close. I'm your host, Hilary Russo, where we are at the St. Francis Hospital in Hartford, where the latest technologies is making gynecologic cancer surgeries a quick and nearly painless procedure. Dr. Beth Nelson is board certified in gynecologic oncology and has been at St. Francis since 1998. She treats gynecologic cancer patients with robotic surgery. However, years before, she never imagined she'd be using robots to operate on patients.
You know, when I first went into practice 20 years ago, I had no clue that we would ever be doing this kind of thing.
St. Francis is equipped with the Vinci surgical system, the only FDA-approved robotic surgery system on the market. With the use of bedside consoles with remote controls that mimic the movements of surgeons' hands, a variety of procedures can be performed with minimal effects on patients. This is a big advantage for the delicate procedures that Dr. Nelson performs on her patients.
And the thing that makes it so useful for gynecologic cancer surgeries, besides the fact that we can use small incisions, is that it allows us, with simple foot controls, to zoom in and zoom out so we can get very, very close to the structures we're operating on. And also the little surgical instruments totally mimic the position of the surgeon's hands in the separate location where we're sitting and manipulating things, so that it's almost like you've got a tiny little hand in that patient's pelvis. And in some cases, that makes us able to do surgery actually more easily than if we had a big open incision.
Before robotic surgery, gynecologic patients who needed surgery would undergo a painful procedure with a much longer recovery time.
The most common cancer that we treat with the Da Vinci robot system is uterine cancer. That's the most common GYN cancer. There are over 40,000 cases a year in this country, and the general treatment is removing the uterus, cervix, tubes and ovaries, and lymph nodes from the pelvis and around the aorta. And that used to be a big open vertical incision. We made big incisions that went from the pubic bone up often to above the belly button, sometimes right up to the rib cage, in order to do these big cancer surgeries. A common problem with that was that the incision wouldn't heal well, they'd get an infection, couldn't get going on chemotherapy, and just a lot of pain and suffering.
With open surgeries, patients would have at least 6 to 8 weeks of a recovery time. Now, with the less invasive procedures, patients can be released just a day after surgery.
The patient would be in the hospital, 2 to 5 days, and then have a 6 to 8 week recovery time. Now with this, we can do all of that through 4 little incisions, half-inch incisions, and the patient generally goes home the next day, is up and around in, a couple of weeks, feeling almost back to normal. One of the big advantages for that is that if the patient needs additional treatment like radiation or chemotherapy, she can get going on it much more quickly and come into it much stronger. I think what women tell us all the time is that they thought that the impact of surgery on their lives was going to be much, much worse, and they're generally kind of amazed and grateful that they got through the surgery kind of almost unscathed.
Another unique aspect of robotic surgery at St. Francis Hospital is their state-of-the-art double console operating room, where surgeons can perform various robotic procedures as well as train residents with the latest technology.
With the opening of our new kind of state-of-the-art operating room last year, we purchased a Da Vinci SI system, which is the newest system. The other advantage that we use here all the time, we have a residency program, and so we're training GYN residents to go out and do the whole panoply of surgeries. And we really were the first in Hartford to train our residents with robotics so that when they left residency, they could actually go and practice robotics. And a couple of them have been responsible for setting up robotic systems at the hospitals that they've gone to. The advantage of the two consoles is I'm sitting at one, the resident is sitting at the other, and I can give her the instruments, but at an instant's notice, I can take them back. So I could take them back and say, no, this is what I want you to do. I also have a little pointer that she can see in the same three-dimensional field that I see to point out, okay, this is the uterine artery, this is the ureter, so that we can stay safe and they can learn the best way to do it. So that is really unique. I think one unique thing that we have is that we really have a great team approach with the GYN oncologists, a GYN pathologist, medical oncologists who administer chemo, radiation oncologists who work very closely as a team. We have a meeting every week called a tumor board where we review all the pathology and all the cases that have come up that week in order to kind of provide a unified collaborative approach and options for these women. I think they get very thorough care, and I think we pride ourselves on being compassionate and really trying to see the whole family as we care for women.
For more on Dr. Nelson and St. Francis Care, you can visit our website at seasonsmagazines.com or stfranciscare.com.